And again, want to thank everybody for joining us for this week's Community Leader Call. My name is Tomas Talamante, and I'm Deputy Chief of Staff to Mayor Muriel Bowser. I want to thank you for joining us tonight and every week as we discuss the district's response and recovery efforts related to coronavirus. Want to remind everyone, if you have any questions, you can press 0 now to be entered into our question queue. Also, today we are joined by the DC Director, or the Director of the DC Department of Health, Dr. LaQuandra Nesbitt, as well as the Director of the DC Homeland Security and Emergency Management Agency, Dr. Christopher Rodriguez. They'll be here to assist with questions during our Q&A portion of the program. I also want to remind everyone again, as always, you can go to coronavirus.dc.gov for the most up-to-date information and resources related to the district's response on COVID-19. Just yesterday, we released the updated list of states that DC Health has classified as high risk. 2 states were added to the list. That includes Montana and Ohio, and 2 states were removed from the list. That includes Alaska and Arizona. So you can go to coronavirus.dc.gov/phase2 to look at the list. And also, we update that list every 2 weeks, so that list will be updated again on Monday, September 21st. And we also want to remind residents and continue to remind residents that testing should not be used as a replacement for quarantine or for choosing your activities and interactions wisely. But however, if you feel sick or you believe you're exposed to someone with COVID-19, you should first contact your healthcare provider or community-based clinic. If you need a test but are unable to get a test through your doctor, you should go to one of our public testing sites. And again, those locations are available at coronavirus.dc.gov/testing. And the last thing I wanted to bring to everyone's attention is next week, we will be kicking off the Mayor's annual National Maternal and Infant Health Summit. And we are very excited to continue to hold the event this year, and it'll be completely virtual. So we're still expecting great and productive conversations, and we'll be able to share resources of moms, dads, and everyone. So we'll kick things off next Tuesday with a panel of what we've learned from COVID-19 and the pandemic's impacts on perinatal health and our next steps related to that, and that it will include Dr. Fauci, as well as U.S. Representative Robin Kelly from Illinois' 2nd Congressional District, and Dr. Elisa Maybank from the Chief Health Equity Officer at American Medical Association. So you can find more about that information about that panel and the entire summit, as well as RSVP for the summit, by visiting dcmaternalhealth.com. Again, that's dcmaternalhealth.com. So we'll hope you'll join us next week for the summit. And we look forward to taking your questions this evening. So again, we have Dr. Nesbitt and we have Dr. Rodriguez on the line to answer any of your questions. So if you can press 0 now, we will go through our Q&A portion of the program, and we can get started there right now. So the first question, we're going to go to Terry King Terry King in Ward 8. Sorry, it looked like you disappeared on my call tool, but you were there. Terry, your line is unmuted.
Thank you so much. I have a question for the panel. I'm a 65-year-old godmother and grandmother of a 3-year-old and a 5-year-old that's doing the virtual learning from 8:30 a.m. until 4 p.m. And sometimes the teacher puts on subsequent work about 8 o'clock at night when we're all asleep. I have a question. What are they doing for essential personnel? Because those 2 young fellas have essential personnel parents, and it's a little frustrating for me, or exasperating, to have to sit with both of them because I can't give them my individual attention. Okay. So I'm running from one school to another trying to keep up, even though the teachers are understanding they're losing something in the, not having that one-on-one care.
Thank you for...
What are you... Mm-hmm.
Oh, I think we just cut off, but thank you for the question. We can go to Dr. Rodriguez, but I think you said you may have had a pre-K student that you had questions around related to that and students using multiple devices. I know that DCPS for those students, DCPS students that are in pre-K, they will begin in the middle of September to distribute out the iPads that are the best device for students pre-K in the pre-K setting. So those families were given packets and have been doing packet learning, and then we'll get the iPad devices when they move to the online learning for pre-K students. So just to address that first question, then I don't know if Dr. Rodriguez had anything else to add.
Thanks, Tomas, and thank you for the question. Yeah, and I think as a father of 3 young ones as well, it can be very difficult at home, sort of going between the different classes and managing sort of a 3-year-old and a 5-year-old in what they need to do. One of the things that I think is helpful is that DCPS is really looking at how to also in this virtual learning environment, how to improve some of the classroom instruction. I think for the first week, gotten out a lot of some of the issues that were raised in terms of the technology. So to what Deputy Chief of Staff Talamonte said, those devices are available, and if there are any issues with them or toggling between both of the kids, definitely the school would be the best place to go to resolve those issues.
Thank you, Director Rodriguez. And again, want to remind that to any families on the line that if you are in need of a tech device or internet supports, please reach out to your school, and they can get you the devices needed. And as well as OSSI and Octo have partnered to provide affordable internet access to families in need. And so that is going to be occurring as well. So we just encourage families to reach out to their schools in that. So we're going to go to our next question. We have Anna in Ward 3. Anna, your line is unmuted.
Hi, thank you so much. This is Anna. I really appreciate these opportunities to hear from you all. I had a question about whether there are any particular resources or guidance for apartment dwellers. I live in a large apartment building that's managed by a management company, and there's just a lot of challenges within the apartment setting around people not complying with the mayor's mask order within, common spaces, laundry rooms, and things like that. And the management company not really enforcing or emphasizing them for apartment dwellers who live here. So I'm just wondering if the office has any good guidance on that I could, advocate for the people living here with the management company.
Hi, this is Chris Rodriguez.
Go ahead, Dr. Rodriguez.
Okay, and of course, let also Dr. Nesbitt weigh in. But yes, there is specific guidance for apartments on coronavirus.dc.gov, and we've gotten this question a few times in these community calls about challenges at times with some of the management companies in enforcing and putting proper signage throughout the buildings. Again, coronavirus.dc.gov has a lot of written guidance, but also signs that are easily printed out to be displayed in apartment buildings. And I would just encourage you to continue to push management companies, if there is a specific problem in your apartment complex, to make sure that there is proper signage and that they are reading the guidance. And you can print out the guidance right on coronavirus.dc.gov for apartments.
Thank you, Dr. Rodriguez. And I don't know if Dr. Nesbitt, if you had anything else to add to that.
No,
Right.
it's just a reminder to folks that they can check the website for any guidance documents, and that if you have any issues or concerns with management of any apartment building or co-op, you can always communicate with DCRA and the Office of the Tenant Advocate.
Thank you, Dr. Nesbitt. We're going to go next to Larry in Ward 6. Larry, your line is unmuted.
Yeah, my name is Larry Coffer, Ward 6, Capitol Hill, and I have two perspectives. I'm a volunteer president of Sports on the Hill, and we have about 1,000 kids in our outdoor sports program, and I wanted to learn when we might transition to phase 3 so that these kids and families can get out. And with respect to distancing in groups, that part is reasonable, but we can't get out and can't get to the field access. And if the phase 3 is not happening soon, can also that I'm also a senior and I swim regularly at the natatorium when it's open, and I would suggest and advocate that at least an opening venue for the indoor pools for seniors for laps is something that it seemed like it can be done with a minimum risk, as I'm a veteran swimmer, and would like to know if that can be considered.
Thank you, Larry. We'll go to Dr. Nesbitt for comments first.
Yes, so thank you for your feedback, and we continue to monitor the public health situation in the district. It's important for people to recall that we are in phase 2, and there are a number of activities or things that we would like to still implement in phase 2, including having our students return for in-person education. And we will prioritize having those activities be implemented before we transition to phase 3. So we don't yet have a timeline for moving into phase 3, but we'd like to implement our phase 2 activities before doing that. In terms of whether or not we will have indoor pools be open, and indoor pools don't only exist at our parks and recreation facilities, they also exist in hotels throughout the District of Columbia. That's also something we will continue to take under consideration. And as you've mentioned, there are potentially some safeguards that we could put in place, such as restricting them for lap swimming as opposed to free play or free use, restricting the use of decks and other things. So, again, those are things that we'll take into consideration. But as we implement or allow for other activities, we have to do it in a sequential way, such that some of our public health priorities aren't compromised with implementing new activities. But again, I do want to make sure that I'm emphasizing, as others who are listening may have some of these additional questions, we want to be sure that we can fully implement the full complement of activities that are intended in phase 2, which includes in-person school, prior to transitioning into any activities that are planned for phase 3.
Thank you, Dr. Nesbitt. We're going to go next to Mary Ann Miller in Ward 3. Mary Ann, your line is unmuted. Mary Ann, your line is unmuted. All right, we'll go to our next question. We'll go to Renee Pearsall in Ward 1. Renee, your line is unmuted.
Hi, I was calling because the church, Park Road Community Church, I'm the pastor of, and we would like to do a fellowship outside of the church. I know we can't fellowship inside the church, but we want to do like maybe have hamburgers and hot dogs on the parking lot or outside, and I wanted to see if that's acceptable, if it's safe, where we are on that part.
Gatherings of any kind that exceed 50 are not permitted in the District of Columbia, regardless of the institution.
Thank you, Dr. Nesbitt. And we do have guidances up for our mass gathering guidance, as well as guidances for the faith community and other guidances in general for those types of, for different activities available at coronavirus.dc.gov/phase2. So just want to make sure that, as Dr. Nesbitt said, gatherings are restricted above 50, but you can look at all of our guidances as well as the mayor's orders related to the public health emergency at coronavirus.dc.gov/phase2. All right, we're going to go to our next question about, this one's from Kay Smith. Kay Smith, you're in Ward 2. Your line is unmuted.
Hello, good evening to everybody. I would just like to know some overall information on this potential corona vaccine. I know it's not much known, but can any of the physicians speak to that?
So we won't be providing lots of detailed information about the vaccine on this call. What we are able to provide to you all is, one, to encourage people to participate in the clinical trials. There are some trials that are happening in this area, in the region. It is critically important that we have representation of a diverse cross-section of our community, including people of various age groups, including people of various racial and ethnic backgrounds, gender, and people who have different health status. And the reason why that is important is because COVID-19 has disproportionately impacted certain groups in terms of race and ethnicity, has had an increased mortality amongst males, and has also disproportionately impacted individuals who have a history of chronic conditions in terms of morbidity and mortality, or severe, I should say, how severe the illness is and the increased likelihood of death. The purpose of the trials that are underway is to determine, one, if vaccines can be safe, and two, how effective the vaccine is in helping us to develop what we call an immune response, such that if we are exposed to the virus, that is SARS-CoV-2 is the name of the virus, we won't develop the disease, which is COVID-19. So it is extremely important that as all of these different companies are developing different types of vaccines to determine which ones are going to be safe and effective to then release and make available to the public, that we recognize, and many of those companies signed on to a statement yesterday stating that they are not, despite any conversations that are going on publicly, they are not going to be releasing any vaccine that is not both safe and effective. And as a physician, I can tell you that that is something that we are very appreciative of and proud to have them do. But we also want to make sure that people are participating in the research process. The newer events that happened where you hear a company has had to stop their clinical trial because someone participating in their trial experienced side effects are just things that happen in clinical trials. That's the actual purpose of the clinical trial, is to see if people have side effects. And that's what it means to determine safety and efficacy. So I don't want people to be alarmed or to think that things are being rushed because those things are happening in clinical trials. That company did the right thing. It stopped the clinical trial. They're assessing why that individual had side effects, if it's something related to that individual's health status, how the vaccine was administered, et cetera. So I think we need to make sure that we're not confusing things that happen around whether or not there's political pressure to rush a vaccine versus having confidence that physicians and scientists who are part of the process are still acting with integrity. Having a vaccine that creates immunity is a critical part of the process that is going to help us get to types of activities in our communities in the District of Columbia, in the U.S., and quite frankly around the world that we all are aspiring to. And so we should be listening to trusted physicians scientists, public health professionals who are monitoring this process and who can give feedback from the question that, such as the one that you've asked. And there are many of us who are doing that.
Thank you, Dr. Nesbitt. We are almost at time, so I want to remind everyone, if you have a question and you haven't pressed 0 already, please do so. We're going to go next to Pauline Curry at Ward 1. Pauline, your line is up.
Yes. Good evening. First of all, I have to thank you guys because I know you've been doing so much since this pandemic, and we appreciate that. So, I spoke to this lady. My question is kind of late because since 3 months or 4, I was joining this meeting. Since that started, I never have a chance to participate. It's okay. And also, I have another question about the like single mother with the kids, and they have to stay home and take care of the kids, and they have to work. They have to pay rent and pay bills. They have so many things to do, and there is no income. So I don't know if you guys are going to do something about that. I know.
All right. I think your phone got cut off there, Pauline, but we can go to Director Rodriguez for the first response on it.
Yeah, thank you. And I think what the caller was referring to was some of the economic hardships that folks in the community and in the city are experiencing, particularly in this age of COVID. And Mayor Bowser announced today that we, as a city, have received grant funding from FEMA, from the Federal Emergency Management Agency, to provide $300 per week to people who have lost their jobs as a result of the COVID pandemic. And I think this is just part of the Bowser administration's ongoing efforts to make sure that we're doing everything we can to help our residents, both economically and, of course, through a support system for the return to virtual school. So if you'd like more information on that program in particular, please go to the Department of Employment Services website and get more information. So thank you, Tomas.
Thank you, Dr. Rodriguez. And again, that's DOES.dc.gov for that site. I also want to, because we're about at time, but I want to remind everyone that if we did not get to your question today and you're in the question queue, a representative from the Mayor's Office of Community Relations and Services will be following up with you following the call to make sure that your question is answered and get your the information requested back to you. So we promise you no question will go unanswered. So if we didn't get time to go through it today, that is, you'll hear a call back from our Office of Community MOCers, as we affectionately call them. Also wanted to remind everyone for information related to the district's economic recovery, DEMPED, that's Deputy Mayor for Planning and Economic Development, that agency is leading on the DIRT team, as we're calling them, which is the district's economic recovery team. So they're leading the efforts related to that. They have a call every Tuesday at 4 p.m. And they also have more information for business relief and funding opportunities for small businesses. They also have a COVID-19 business recovery podcast series that they're hosting. So we just want to remind everyone about that. That information is available not only at coronavirus.dc.gov, but also demped.dc.gov. So we had a few questions related to that are in the hopper related to small business supports, and so just wanted to make sure everyone was aware of that. So we are going to go to Sarah Goldsmith in Ward 6. Sarah, your line is unmuted.
Hi, I had a question about what's being done to work towards reopening schools. I have 2 kids, one that is in first grade and one is in pre-K, and we are just struggling with the virtual model, I guess, with 2 working parents.
Thank you, Sarah. We'll go to Dr. Rodriguez, who is also a a father with multiple kids at home doing virtual learning. So, Dr. Rodriguez.
Thank you. Yeah, thank you for that question. I think we're all, we're in a not an ideal situation with our kids being not in school, and I know that in the Mayor Bowser talked about this today at her press conference, that her top priority is getting kids back in school. And Dr. Nesbitt has also reiterated that on this call in terms of some of the activities that we're looking at in phase 2 in order to create, for lack of a better term, like the public health space to return our children to school, because that's where kids do their best learning, both educationally and emotionally and socially. So that is the top priority for the mayor, is getting our kids back in school. And as the mayor said today at the press conference, you'll be hearing more about that in the coming weeks. So thank you, Kamal.
Thank you, Dr. Rodriguez, and thank you, Dr. Nesbitt, for being on to answer questions today. Again, I want to remind everyone, if we were not able to get to your question today, you'll be hearing from a representative from our MOCRS team to answer your questions and to just follow up in general. We want to thank you for joining us this week for the call and every week, and want to close out by reminding everyone to please visit coronavirus.dc.gov for the most up-to-date information and resources related to the district's response. And we just want to thank you for being on, and we will talk to you next week at 5 p.m. on Wednesday. Thank you so much, and have a great evening.